We've talked a lot about ADHD. What other conditions can you treat nutritionally in terms of behavior conditions?
Well, actually, we started with behavior and learning, but we've seen more than 3,000 cases of depression. And I think I have the world's biggest chemistry database for depressed people, diagnosed with clinical depression. And what I've learned is that depression is a name given to completely different disorders. And there's a misconception in mainstream psychiatry, a misconception that depression is really a single condition with variations along a central theme. And they believe that in general, and almost always, it has to do with low serotonin activity, which is why they want to give SSRI antidepressants, which are serotonin enhancers, basically, serotonin activity enhancers. But what we find is that, and it's described in my book, I've just written a book on the subject, and what we have learned is that we know there are 5 completely different phenotypes or biotypes of depression. And each one of these different types of depression involves different neurotransmitter abnormalities and require a different treatment. And we've developed nutrient therapies for each of these 5 types.
So how can people know if they might be deficient in these nutrients? Is there a definite way you can tell?
Well, I think so. I assume that a person wouldn't seek help unless they were having a serious problem. Mm-hmm. So there are doctors and clinics who are quite expert in identifying this, but you'd have to get somebody who is familiar with this kind of testing. And it would require methylation testing, determination of a person's methylation status, their metal metabolism. It would be important to look for toxic metals that might be elevated in a person that could be causing difficulty. It really is a medical procedure, best done, I think, by a medical practitioner who's experienced. And to do it right, you have to know a lot about the patient. You get a lot of clues about the imbalances from the symptoms and traits. For example, if a person has elevated copper, they're probably going to have trouble sleeping, history of skin sensitivity. They'd be sensitive to rough fabrics. They are prone to ringing in the ears. There's about 30 symptoms that are consistent with high copper, and a completely different set of symptoms and traits for each one of these imbalances. So it really helps in doing a diagnosis to learn everything about a person, and then to do the lab work. And the ideal is when the indications from the symptoms and traits dovetails with the lab work, and then you can make a confident diagnosis and then establish a treatment program.
Mm-hmm. And in terms of seeing a professional for this, the same would go toward treating it too, because you can buy these supplements over the counter, the zinc and the copper and the folic acid and things like that, but you must be talking about a much higher dose or higher grade, or it's delivered differently, or one of those.
Yes. If we were to do a complete metabolic analysis of anybody, including you or I, we would probably find that, let's say we did your analysis, we would probably find there might be 5 or 6 important nutrients that, because of genetics, you were low in.
Okay.
And you would benefit from many times the RDA of that, because you might be fighting genetics. And the goal was always to normalize blood levels and brain levels. We would not be trying just to be giving large amounts of something. Our goal is to normalize a person's biochemistry.